This is going to be a short demonstration of knee controlled articular rotations, or CARs. Also, I'm going to show you some CARs for the ankle and toes, and then we're going to do some kinetic stretching for the knee, and then some CARs for the kneecap. So stay tuned and enjoy. Starting with the knees, hold on to the back of the thigh and press the knee into the chest as you extend the knee and rotate the tibia out and in on the way up and down. So noticing that I'm creating circles with the knee here, out and up, in and down, and then go in reverse, in and up, out and down, in, up, out, down, using my toe as a guide point when I'm externally and internally rotating my tibia. So that would be a knee circle. For your ankles, press the knee into the chest, hold on nice and tight, and press the opposite heel into the ground as you create tension and circulate that ankle in its full range of motion. Use your toe as a guide point to create the circle and just pretend that you're drawing a full circle with the toe. When you're doing this, it's important to squeeze as many muscles as possible to help control the range of motion that you're currently specifically utilizing. So in this case, the ankle, focusing all energy recruitment for that ankle. And you'll notice that it's not as easy as you think with the more intensity you actually put into it. After that, we're going to get into the toes. As you see here, I'm bringing the big toe up in the air, extending the toe, and then switching to just the small toes, and then going back and forth from big toe down to big toe up. Your big toe should be able to lift off the ground. If not, use your hand to pull it up and use a passive support as much as you need until you can get an active support. And noticing that I'm trying to separate my toes, I'm pianoing my toes down to the ground from the pinky to the big toe, and then obviously going from big toe to the ground to little toes to the ground. After that, I'll do a couple more ankle circles just to move everything around. Here I'm grabbing the outside of the foot with the opposite hand and holding the forearm. And as I'm doing this, I'm pressing the opposite way with the foot, as you see here. So a little bit of kinetic stretching. This would be kinetic external rotation. Noticing that I'm trying to go out with the foot with a little bit of tension. And then when I switch my hands the other way, I'm doing kinetic stretching internal rotation. You can also do pals and rails in this stretch. There's a lot of videos. You can look up pals and rails, internal and external tibial rotation. I know Chungy Chung has a great one that you can check out. And tibial rotation is really important for obviously squatting and strengthening the knee. Here is an example of tibial external and internal rotation. After doing that, I'm going to circulate the patella from a 12, 3, 6, 9 o'clock pattern, using my thumbs as guide points to circulate that patella in a 360-degree manner. And really just taking my time in my ankle, my knee, every circle that I perform is with intent. I'm not just pushing tissue around, I'm actually assessing tissue. And that's the point of controlled articular rotations, is to assess your tissue so you have better awareness of your current capacities, and so you're going to be able to train in a better and more knowledgeable way. So good luck. Have fun.